Plexus and Center for Metabolic Surgery. Headed by Dr. Raman Goyal, the Center for Metabolic Surgery is amongst India's top bariatric surgery center. CMS represents a comprehensive team of surgeons, physicians, dietitians, and psychologists to assist on weight loss surgeries. Today, we will be discussing the impacts of COVID on obesity. Obesity develops in an individual with energy intake exceeds energy expenditure over a prolonged period, and excess is stored as triglyceride predominantly in adipose tissues. To throw more light on this, we have our guest speaker today, Dr. Kedar Thoraskar. Dr. Kedar Thoraskar is one of the best critical care specialists in Mumbai with a vast experience of more than 2 decades now. He is currently consulting at Wokhart Hospital, Mumbai. After completing his studies from GS Medical College, Edward Hospital, Mumbai, and after completing his post-graduation from JJ Grant Hospital, Mumbai, Dr. Kedar has been practicing in the field of critical care since 26 years now. He has, to his credit, a lot of international and national publications. He is an enthusiast teacher and he keeps taking part in a lot of international and national conferences. We are very happy to have you on board, Doctor. I request you to please start your presentation.
Yeah, thanks for the modest introduction, Dr. Unnati. And I thank Dr. Plexus and Dr. Raman Goyal and his team for allowing me to talk here, giving me this opportunity.
We can't hear you, Dr. Kedar. Seems you got muted.
Yeah, can you hear me now?
Yes. Again, you are muted, Dr. Kedar.
Okay, can you hear me now? Yeah.
Yes.
So sorry for the technical glitch. So the last 15 months or 16 months, we have been fighting with COVID, and we have lost a lot of doctors, healthcare workers, a lot of patients with COVID. This is the worst pandemic which we have seen in our lifetime. So what does COVID mean for obesity? Okay, so this is what I'm going to talk in the next 15 minutes or so. So these are a few facts before I start. So obesity is known to influence most of the major cardiovascular risk factors, including dysglycemia, metabolic syndromes, type 2 diabetes, hypertension, and these have adverse effects on the cardiovascular structure and function also. Additional morbidity also includes chronic lung diseases like COPD, asthma, systemic inflammation, and all forms of cardiovascular disease in the setting of increased adiposity. Heart failure, especially heart failure with nerve dissection, coronary artery disease, atrial fibrillation, peripheral arterial disease, you name it, and you have all the complications with obesity. Now, just going back before the pre-COVID, we had a swine flu epidemic. Okay, many reports identified obesity and severe obesity as risk factors for swine flu also, and this included hospitalization, mechanical ventilation, and mortality because of H1N1 influenza. And obesity clearly increased the duration of viral shedding in the influenza A virus. So this was pretty obvious before COVID also. So what about COVID? So COVID, CDC has identified severe obesity, that is BMI above 40 kgs per meter square, as a common clinical risk factor for worse prognosis and higher mortality in these patients with COVID-19. Any degree of obesity, any BMI of 30 kgs per meter square has been associated with a poor prognosis in patients with COVID. Now, evidence suggests that COVID may be detrimental in patients, obesity may be detrimental in patients with COVID-19 infection, and there is a potential for development of and worsening outcomes of COVID-19, including respiratory and multi-organ failure. And we have seen obvious higher mortality in patients with obesity or afflicted with COVID. Now, this is the angiotensin converting to enzyme expression in the adipose tissue. Now, as you all know, that COVID affects the ACE2 receptors in the body. Wherever you have ACE2 receptors in the body, the spike S protein attaches to it, causes the infection. So In adipose tissue, these ACE2 enzyme expression is much higher than as compared to the lung tissue also, which is supposed to be the primary organ which COVID-19 affects. So that means that adipose tissue may be vulnerable to the COVID-19 infection. Now, this was published by WHO way back last year. The effect of COVID-19 can be worse for people with obesity. And this is one slide which classically tells you what is the danger of the extra kilos. So this study was done in 3.34 lakh people in England in spring, and the chances of being hospitalized with COVID-19 increased steadily with their body mass index. Now, if you see if in a normal body mass index, a normal weight person with a normal weight with a BMI less than 25, the hospital admissions per 10,000 were to a tune of just about 10. Okay, in overweight patients, BMI between 25 to 30, that went up to almost 20%. For stage 1 obesity, it jumped up to 22, 25%. And for stage 2, it exponentially rose to almost 42, 43%. So this shows that obesity is a major risk factor for COVID. Now, one more study which showed that not only hospitalization, but those people with COVID, okay, those people with obesity had a higher criticality of COVID. So if you see these both bars, the bar on the left side shows that the patients with BMI less than 25 are not obese, had much lesser complications, respiratory complications. They required lesser oxygen, they required lesser intubations, and they landed up in the ICU less commonly as compared to those patients who had BMI more than 25. So if you see here, 16.7% versus 34.9, almost 40% in patients with BMI above 25. So that's a big jump. Now, one more study here also showed a similar thing, that obesity and critical COVID-19 was correlated. And if you see this, the x-axis shows the population, general population, the population with severe COVID here. And if you see the standard prevalence ratio of obesity, this is on the y-axis here. Now, for general population, if it was around 1, it was for severe COVID patients, it jumped up to 1.8 to 2.88 for very critically ill patients here. So this study was done by Lyon and Lilly. Okay, so they compared the general population with patients with obesity and severe COVID. Now, what are the potential mechanisms linking obesity and vulnerability with severe COVID-19? So to your left are systemic factors. Now, these systemic factors can be increase in the inflammatory cytokine production. So we all know that we have a cytokine storm in COVID, which is responsible for all the complications and which would require mechanical ventilation. Now, this exactly happens in patients who are obese. They have compromised immune function as well. There is increased insulin resistance and impaired glucose regulation. That's why we are seeing a lot of patients with dysglycemia. One of the reasons for that is that the ACE2 receptors are also in the pancreas, and COVID affects the pancreas also. So obesity adds to the problem. Now, decreased heart function, decreased tissue perfusion, and overactivation of the RAS, that is the renin-angiotensin system, also adds to the problem. Now, on the right, you have the biomechanical factors. Now, these are decreased lung compliance, decreased FRC, that is a functional residual capacity because of a restrictive lung disease in obese patients. You have increased hyper airway responsiveness, and there is a collapse of the small airways. So that leads to more pulmonary complications in patients who are obese and have COVID. The esophageal pressure and the gastric pressure is also increased, and the obstructive sleep apnea adds to the hypoxemia. So these combined with the systemic factor adds to the complications of COVID-19 in obese patients. Of course, you have diabetes, hypertension, cardiovascular diseases, dyslipidemia, non-alcoholic steatohepatitis or NASH to add to the problem. And that increases the vulnerability to COVID-19. And of course, it increases the likelihood of a severe course in COVID-19, which we have all seen in the last 15 to 16 months. And that translates into a higher mortality rate. Now, this was published in the Journal of Obesity and Metabolic Syndrome, June 2020, as early as last year, 1 year back. Now, this was a excellent article, a path-breaking article, which was published in Mayo Clinic in last year, July 2020. Okay, and they rightly worded this as when an epidemic and pandemic collide. So we already have an epidemic of obesity, and when it collides with the pandemic of COVID-19, it causes a catastrophe. So this is again what I have discussed. But to add to the problem, you have hypercoagulability because the adipocytes and the coagulation factor increase. There is a decreased fibrinolysis and there is increased inflammation and oxidative stress. Apart from that, you have endothelitis also. Now, what is endothelitis? This is classically immune endothelitis. This is viral endothelitis because COVID-19 affects the endothelium, because endothelium also contains the ACE2 receptor. And endothelium is everywhere in the body, in the arteries, in the veins, in the capillaries, everywhere. Wherever you have blood circulation, you have endothelium. And the COVID-19 virus affects the endothelium all across. And this is true in obese patients also. Okay, kidney disease also is exacerbated because of podocyte hypertrophy and dysfunction. You have heart disease, which I just told you in the previous slide, that you have heart failure with preserved LV function. You may have a cardiomyopathy and increased risk for AF. You have pulmonary dysfunction apart from the other thing. Now, interestingly, you have inflammation also, and in COVID with obese patients, you see increased leptins as compared to what you have in a normal person or a obese person without COVID. You have increased production of TNF alpha and IL-6, interleukin 6, which are also responsible for the cytokine storm, for which we use tocilizumab, okay, or these MABs. And you have immune dysfunction, you have impaired function of T lymphocytes and the subpopulation. So all these things add to the problem. One more slide which shows that adipose tissue, okay, is a precursor for COVID. So whenever COVID affects the adipose tissue, which is more than the size of the lung also, you have angiotensinogen which is produced, and this is converted to angiotensin 2. And because of the COVID affecting the ACE2 receptors, because of inhibition of the ACE2 receptors by COVID, there are increased levels of angiotensin 2. And this angiotensin 2 is responsible for the vasoconstriction, inflammation, fibrosis, and oxidation, leading to ARDS and leading to acute lung injury, which is one of the worst complications in COVID. Now, again, here, whenever the adipose tissue is affected, there is a decreased viral clearance of COVID-19, and adipose tissue acts as a reservoir of this COVID-19 infection. That's why there is a prolonged viral shedding, and the viremia lasts a little longer or much longer as compared to normal patients in obese patients. So that is a crux of the pathophysiology of COVID-19 in obese patients. Now, what are the other comorbid conditions which are associated, which potentially implicate worsening of prognosis in COVID-19 in obesity? So obviously, we have discussed most of these, endocrine being insulin resistance, pre-diabetes, and type 2 DM, which is exacerbated in COVID. Dyslipidemia, including hypertriglyceridemia, as we have seen a lot of triglyceride elevation. Autonomic nervous system is also affected. COVID per se affects the autonomic nervous system, and that is more enhanced to obese patients. We see a lot of bradyarrhythmias, tachyarrhythmias in these patients, and overactivity of the RAS, and systemic arterial hypertension, chronic kidney disease, immune inflammatory reactions, cardiovascular and pulmonary we have already discussed. Hematology is one thing which I would like to go into the depth. Okay, hypercoagulability, and there's a tendency to thromboembolic disease and increased risk of cancer also. So long term, these patients with COVID-19 may also have an increased risk of cancer. It may be colonic, gastric, esophageal, predominantly GI cancer or hepatobiliary cancers. Now, one more path-breaking paper which was published in May 2012 in the Lancet Respiratory Medicine. COVID severity and obesity, are mate cells a factor? So let's come to what are mate cells. Now, obesity is associated with important defects in immune cells tasked with host protection, and these include the natural killer cells, what we call as the NK cells, and mucosal associated invariant T cells, which are the mate cells. Okay, so these are very, very important. These mate cells are important, and several publications have highlighted mate cells as potentially having a crucial role in the host response to the SARS-CoV virus. Now, each of these studies showed that there was a peripheral serum mate cell frequencies which were reduced in COVID-19. So mate cell population came down in COVID-19 with obese patients. And there is a striking observation of these studies in COVID-19 with increase in the activation of the CD69 marker. Now, mate cell activation is done via the CD69 marker, and it was associated with prolonged hospitalization, a low PF ratio, and an increased SAP score, which increased the mortality, obviously. And these mate cells, the pulmonary mate cell, increase the expression of the IL-17A. This cytokine is implicated in the pathogenesis of COVID, and this leads to development of ARDS. Now, analysis of alveolar lavage single cell data set by Parrott and his colleagues showed that these mate cells were predominantly T cell source of the IL-17A. So there is a correlation with IL-17 and mate cells. And COVID-19 associated alterations in these mate cells reflected that they were much more in patients with obesity. Now, reported reductions in the mate cell frequency were seen in patients with obesity, and mate cell from people with obesity also displays a loss of interferon alpha, a cytokine that is very important for antiviral responses in our body, and elevated levels of IL-17, which I just mentioned, which is the established driver of the ARDS. So reduction in the interferon alpha that led to loss of antiviral responsiveness, and of course increase in the IL-6, which increases the ARDS incidence. So what about mate cells and Covishield? Now the study by Provin and his colleagues also highlighted mate cells as an important mediator for adenovector virus immunogenicity. Now this was found in the Oxford virus, which is known as Covishield in our country, and the mate cells in both mice and humans had increased levels of the activation of CD19. Now the Oxford vaccine activated mate cell produced increased levels of the antiviral molecule of interferon alpha and granzyme B enzyme, which is responsible for vaccine mediated immunity. And this vaccine mediated immunity was supposedly not existent or very low in obese patients. So there are two questions which come out from this study, this path-breaking study. Could poorer outcome in patients with COVID and obesity be the result of the second hit by the SARS-CoV on already compromised pro-inflammatory mate cell population? And could obesity-related mate cell affect the immune bridge proposed by Provin and his colleagues? That's why leading to diminished vaccine efficacy in the patients who have obesity. So let's go to the hypercoagulability triad. So hypercoagulability, obesity, and COVID-19 is a lethal triad. It increases thrombosis in patients with COVID-19, and this results in additive effect of obesity and SARS-CoV infection. Now, increased risk of venous thromboembolism is classically seen. We have seen a lot of more pulmonary thromboembolisms, coronary artery disease, stroke in patients with COVID-19 and obese patients as compared to the other patients. And obesity and overweight have been consistently associated with this increased risk for developing the VTE. Now, hypercoagulability also has been seen in overweight patients without metabolic syndrome, which increases with the severity of obesity. So, what is the mechanism? It increases the action of adipose cytokines, that is leptin and adiponectin is very, very important. Now there is a hyperactivity of all the coagulation factors, whether it is fibrinogen factor 7, factor 8, and there is hypofunctional fibrinolysis also in COVID. So if you see our thromboelastograph reports, which we do to know how thrombogenic a COVID-19 patient is, we have seen almost zero fibrinolysis. The fibrinolytic mechanism is totally shut down by the COVID-19 virus, and this is enhanced by obesity. Of course, angiotensin 2 levels are increased, which I discussed in the previous slide. They have increased oxidative stress and endothelial dysfunction because of viral endotheliitis, and there is venous stasis and impaired venous return, which is a common risk factor in obese patients. Now, what are the other evidences linking obesity to worse outcomes? The first paper, which was published from China by Qingxian and his colleagues, showed that as compared to normal weight per people, obesity group showed almost a 2.4-fold higher odds of developing severe pneumonia after adjusting for the potential confounders. One more group called as Simonet and his colleagues described that obesity represented a major risk factor for severity in COVID-19 patients. And COVID-19 infection with patients with BMI greater than 35 had a seven-fold more risk for invasive and mechanical ventilation as compared to a patient who had BMI less than 25. Petrolini and his colleagues also did a cross-sectional analysis of all patients in New York City, and they found out that those patients with obesity and COVID-19 had a higher incidence of hospitalization and getting complicated, and of course mortality also. One more paper by a meta-analysis by Popkin and his colleagues showed that the odds ratio of people with obesity being hospitalized was 2.1 as compared to those without obesity, and the mortality was 48% higher in patients with obesity than in those without obesity. So that is also significantly high, almost a 50% higher mortality in COVID-19 patients who are hospitalized. Now, one more paper by Leiter, similar thing, that they found out that 3,615 symptomatic patients who tested positive, 21% had a BMI of between 30 to 34, and almost 16% had a BMI greater than 35. So a huge number again here. Now, what do you do? So what is the end point? How do you tackle this? Okay, so we keep on talking about statistics and the increased mortality, but this is what Dr. Goel and his colleagues and we as physicians have a role, and the patient themselves have a role here. So there is a large amount of evidence supporting the role of physical activity and exercise training in decreasing the inflammation in overweight or obese patients. And physical activity and exercise training prevents coronary vascular disease and improves the prognosis of patients with coronary heart disease and heart failure. In obese patients with coronary artery disease and heart failure, survival rates are excellent regardless of the adiposity when fitness is preserved. So even if the patient is overweight, but if they are fit and they are into some physical activity and exercise training, the mortality and the morbidity is much less. So naturally, improving fitness through physical activity and exercise training is needed for primary and secondary prevention of coronary vascular disease and all-cause mortality in obese patients. Now, just to summarize, obesity represents a high risk factor for higher severity and worse prognosis in patients with COVID-19 infection. And obesity induced adipose tissue inflammation and its effect on immune system plays a very crucial role in pathogenesis of COVID-19. This also results in metabolic dysfunction, which may lead to dyslipidemia, insulin resistance, coronary vascular disease, metabolic syndrome, type 2 DM hypertension, and so on and so forth. But a take-home message remains that prevention of obesity in the first place, and especially its progression to more severe form, is desperately needed through the healthcare system and society. Now, these efforts are also needed to improve prognosis for the next pandemic. So, obviously, we will be facing more and more viruses like COVID-19, and we have to be prepared for that. So, obviously, we need some secondary prevention for that, and as well as primary prevention for prevention of coronary artery disease and diabetes. So, in the ongoing COVID-19 pandemic, clinicians should also recognize that obese and more so the more severely obese are a higher risk for clinical deterioration of COVID-19, and this subset of population needs to be carefully monitored and treated more aggressively to reduce the morbidity and mortality. So, with this, I come to an end of my presentation. I would be happy to take any questions if there are any. Thank you.
Thank you so much, Doctor. What an insightful presentation and a much needed topic to be discussed. I think I've been hearing from everyone that we have put on weight, we are becoming obese after COVID. So I think a lot of people will have questions. So we have Dr. Chiranjeev and Dr. Vishnu. Dr. Chiranjeev, would you like to go first?
Yeah, I
Thank you so much. Please go ahead.
Sir, I want to ask, you said that the vaccination efficacy is decreased in obese patient. So is there any indication then how much time it takes if a patient is COVID positive? So when we give advice to take vaccination?
So if a patient is COVID positive, we say that you have to get yourself vaccinated after 3 months period. Okay. So why this 3 months period? Because the natural immunity, the natural antibodies after the COVID start waning after the 3 months. There are studies which have shown that 3 months is the shortest period. There are other studies which show that around 6 months to 1 year, the immunity may, the natural immunity may last. But if you want to get vaccinated after getting COVID-19, the three months period is a good bet here. So after 3 months, the natural immunity goes on waning. So whenever you give the vaccine after 3 months, that boosts your natural immunity and keeps the patient away. We have seen a lot of healthcare workers getting COVID again. Okay, so that is a really real problem. After getting COVID, you get reinfection also. So 3 months period is a decent period for getting vaccinated after contracting COVID.
Thank you, sir. And I have one more question. You advise that physical activity should be done to decrease the risk of COVID and obese patient. So, which type of physical activities like cycling and jogging are good, or we should advise to do gymming and all that thing?
Yeah, so it goes hand in hand. So you have to have a combination of aerobic exercises like cycling, jogging, or brisk walking itself. A lot of gyms were closed, grounds were closed, public areas were closed. So even walking at home makes a lot of difference. So what we tell our patients is that after each meal, previously our grandparents used to tell us to do Shatapauli, that is at least walk for 100 steps or maybe 200 steps also. So that was a very cost effective mechanism of going into physical activity. So a combination of aerobic exercises as well as muscle training both go hand in hand. So if you just do aerobic exercises, you will have some muscle wasting, especially in elderly people, elderly population. So you will have muscle wasting for that. So you have to have a proper mix of aerobic exercises as well as weight training in whatever possible manner. This pandemic has thrown a lot of challenges to us. So even if you walk at home or walk in your compound or walk in your gallery, that itself may be good enough. Or you do some calisthenic exercises like push-ups, pull-ups, or you lift your own weight. That itself is are good exercises. So physical activity goes a long way in reducing the complications, not only for COVID but otherwise also.
Thank you, sir.
Dr. Vishnu, would you like to go next? Do you have some questions?
I think
No, thank you.
Okay, Dr. Kedar, we have one question from the audience, from the live audiences. So I'll just read it out for you. So question is that in other infections like tuberculosis, CAP, and sepsis, which are supposed to have more favorable clinical outcomes in adults with obesity compared with lean adults, why do we see the contrast in COVID?
So it is a multifactorial disease. Now, tuberculosis, if it is pulmonary TB, it affects one organ. If it is, of course, extrapulmonary, it may affect other organs also. CAP is again one organ. But COVID is one disease which affects all the organs because ACE2 receptors are everywhere. I gave an example of endothelium. Now, endothelium is in the body throughout. Wherever you have a vascular structure, wherever you have blood vessels, you have endothelium. And endothelium affects all the parts of the body. So COVID is just not affecting the lung. That thing is wrong. So the difference between H1N1 and COVID is that COVID is a multi-system disorder, whereas H1N1 was essentially a single organ dysfunction. That's why the prognosis of the other diseases like sepsis or not multi-organ, but if you take sepsis in one organ, it's obviously different. And obviously this is a novel virus. That's why we are fighting pulmonary TB, sepsis, community acquired pneumonia. We know a lot about it, and we have established therapy for it. But in COVID, there are two differences. One is it is multi-organ because of these ACE2 receptors being everywhere, and second is we still are not wiser. We are much wiser as compared to what we were 16 months back. But it's a super bug, meaning it is keeping on mutating. Okay, and that's why we have had so much of morbidity and mortality with this novel virus. So these are the differences.
Great. I think that was a very, very precise answer. So we have one more question that has come up. Let me just read it out for you. So this question is by Dr. Arjun Singh. It is said that newer variants of any virus are weaker than the first variant. Then why did Delta variant create so much destruction, and why are we concerned of the Delta plus variant?
Yeah, so again, as I said, this is a novel virus. This is different than most of the viruses which we have encountered previously. It's one in a lifetime experience. Now, what Dr. Arjun says is perfectly right. That virus generally mutates to a lesser virus. Okay, so or a lesser potency virus. But here, the problem with Delta is that there is not only Delta. Delta is a predominant variant now in the world now, of course, because it started with India and then it has gone everywhere. So the problem with Delta is that it is highly infectious. That's what I was telling Rudu also, that if one child is affected, the whole family is affected. So the
Correct.
infectiousness of this virus is much more as compared to the older variant. That's why it is dangerous. And if you have a vulnerable population like elderly person in a family who is affected, even that itself is enough to lead to complications. So that is why this delta is bad, and it is affecting the children also, which is a significant population in India. So if you see our population demographics, children, the pediatric population and the working class is much higher as compared to the Western countries where the geriatric population is high, and we still have not vaccinated all the kids and the population between 0 to 40. So they still have yet to be vaccinated. So that's a problem. So it is highly infectious and it affects the pediatric population also, or the younger population also. That's why it is dangerous. It may not be as it may not lead to as many complications as the previous year, but because of the transmissibility and infectiousness, it is a problem. That's why we
Makes sense. Makes sense. That was a very nice answer. And thank you so much, Dr. Kedar, for taking out the time for coming on board to talk about such an important topic. You made the program, more insightful, more successful. We look forward to hearing from you again. Thank you so much, Doctor.
My pleasure, and I thank Dr. Raman Goel and the Doc Plexus team for inviting me.
Always a pleasure. So I appreciate the efforts. And Dr. Raman, would you like to say something?
Yeah, so before Dr. Kedar leaves, let me put it on record that, we work together in a hospital, that's Wockhardt Hospital in Mumbai Central. And Dr. Kedar is a chest physician there right from the beginning. And during COVID, he was instrumental in pulling through thousands of patients. Wockhardt became center of COVID management in Mumbai. And we trust him so much. When I had COVID, I immediately got admitted under Dr. Kedar and got managed. So I think it's really an honor that he's joined us today, because he is very insightful about COVID and has really brought excellent results. We do not have hospital-wise comparisons of patient outcomes in India, unfortunately. But otherwise, if it is seen, then Wockhardt will be among the first few in the country who had such good outcomes, primarily because of physicians like Dr. Kedar and others at Wockhardt. So
amazing.
Thank you so much, Dr. Kedar, for joining us today.
I appreciate the work, Doctor. Kudos
it's
to you.
It's a teamwork, so it's a teamwork here. So thank you very much.
Kudos to you, Doctor. I appreciate it. Please keep up the good work, and I'm sure the population, the country is blessed to have doctors like you. So without further ado, I think we should take the session ahead. So moving on to Dr. Raman's talk, the man needs no introduction. He's the pioneer of bariatric surgery, as we know, and he's been trained from various countries like France, USA, and brings a vast experience in bariatric surgeries, especially in the laparotomy ones. He's also the editor of Bariatric Journal and has participated in a lot of talks, particularly enthusiastic about academics, about training people, and has taken this amazing initiative to train all our family physicians so that more and more people are aware about obesity and its management. Dr. Raman, over to you, sir.
Yeah, thank you. And thanks to Doc Plexus for hosting this program. The purpose is primarily to interact with family physicians and mostly related to obesity related issues. It's not about bariatric surgery, it's about how obesity affects health of individuals. And obviously I'm a bariatric surgeon, so I'll be speaking briefly about the role of bariatric surgery in COVID and obesity. So once the COVID epidemic started in March 2020, and as Dr. Kedar has shown, early results from China and USA showed that it is having more severe effect with people who are living with obesity or those who are overweight. Our bariatric patients whom we have operated in last 21 years start telling us on a daily basis and started receiving emails that are they at higher risks and how they should manage themselves, because they believe that and even though they have lost weight, many of them are remain at high risk because of various associated comorbidities, and they were being openly discussed through social media and media that how comorbidities, and first time it happened that public at large started using the term like comorbidities and many other medical terms which only doctors used to use earlier and which became a commonly used term, and that made us think that how bariatric surgery affects the obesity. So I thought I'll use this opportunity when Dr. Kedar spoke about medical aspect of it, that I speak a bit about COVID and bariatric surgery. And these were mostly the questions which were asked to us, that are bariatric patients at higher risk of COVID? Obviously, anybody who is obese or overweight is at higher risk, but whether after surgery they were still at higher risk, does surgery increases the risk? Then people started taking various kind of supplements all over the world, and even the natural products in a higher dosage just to protect themselves. And does the treatment of bariatric patient differs if they get COVID? Should they stay at home? Should they go to hospital? Many of them started calling us whether it is safe to take a vaccine and when they should take it and what will be the long-term consequences. So in next 5-7 slides, I wish to answer this based on the evidence. And this study, which got published quite recently, almost about 4 months back, is from a Cleveland clinic, where they studied prospectively from March 2020 till March this year, that whether bariatric surgery reduces severity of COVID-19. And they found that it indeed reduces the severity of COVID-19. So those people who had a bariatric surgery have less severe disease compared to those who did not have a COVID. And how it changes that I'll show you here. These are the outcome of these studies. And they said that those who did not have bariatric surgery had almost 42% admission rates, which is what Dr. Kedar showed in one of his slides. While those who had bariatric surgery, the admission rates reduced to 18%. And this is obviously from American data from Cleveland Clinic. Then they said those who did not have a bariatric surgery, 13% of them required ICU, 7% required ventilatory support, and almost 2.5% of those died, while none of this occurred in bariatric patients. And the author of the study from Cleveland Clinic said patients after bariatric surgery become significantly healthier and can fight the virus better. And so there were some few studies in the past which were done on other viruses which showed that bariatric surgery does improve the risk of infection from virus. But this was the first major study talking about COVID-19 in the pandemic, and which shows a significant improvement, significant reduction of the risk of COVID severity. Then the second major question was, should they take more supplements? Now, what has happened is that there has been a lot of information and misinformation that has gone through social media this time. People talked about various things. But if you look at evidence-based, there are no very definite answers, but it is seen in most of the publications that vitamin A and D supplementation, that means those who are having normal levels of vitamin A and D, or they are taking supplements, they benefit from it compared to those who have deficiencies. So we are not talking of high dose of vitamin D, we are talking of normal dosage, normal levels that should be maintained so that the risk of COVID reduces. Similarly, those who are maintaining their selenium and zinc levels, they have better outcomes in COVID-19. So the two trace elements, and then a lot of talk about nutraceuticals, probiotics are believed to enhance immune functions. This could be Ayurvedic, this could be allopathic, this could be something like curd, any probiotic, and so it is now coming out that these are probably beneficial. And micronutrients help in those who are nutrition depleted elderly patients. So we all know that the senior citizens suffer more from COVID and have more severe disease. So if they have adequate dose of micronutrients, that means they take those supplements, they may not have a severe disease. Now, when our bariatric patients started calling us up about the supplements, we looked through this data and we found that the regular supplements that we advise patients after bariatric surgery have all these. So we need extra supplements, and that is what we told patients, that if you are taking bariatric supplements, you don't need extra supplements to prevent COVID-19 infection. And this is based on the whatever evidence that is available. Then comes, does the treatment of COVID-19, now somebody gets infected, will the treatment differ in those patients? Now, again, there are now publications which are available, and this is from NIH. Quoted it here so that people can themselves check it out. So there are various types of bariatric surgeries. So the bariatric surgeries which does not have malabsorption, and these are almost, let's say, 99% of the procedures that we do, but let's say overall in India, about 80% of procedures are either sleeve gastrectomy or Roux-en-Y gastric bypass. So then there is no different parameters for them. You need to go to a physician and he should treat you like any other COVID patient, and there is no definite instructions or knowledge that you want to share with the physician. If there is a malabsorptive procedures, so there are different kind of malabsorptive procedure. The commonly done malabsorptive procedure in India is a mini gastric bypass, which is done in about 20% patients in India. We hardly do it in less than 1% patients in our practice, but that is fine. Now, in such malabsorptive procedure, you must tell the physician the drugs may not be well absorbed, so they should use comparative dose. They should prefer liquid drugs than the tablets, let's say, and they should prefer intravenous injections if that is possible. So preferred way is intravenous. If that is not possible, then the liquid drugs, otherwise comparatively higher dose. But please remember, this is only for malabsorptive procedure like mini gastric bypass. As I said, 99% patients have undergone a sleeve or Roux-en-Y gastric bypass. Now, going to specific drugs or supplements. So if the physician is prescribing azithromycin, then ask him to increase the dose by 1/3 what he normally gives to a person of similar obesity level or BMI level. If the person is giving you zinc, then it is preferred to give injectable zinc, or if he is giving oral, then the dose should be split so that the absorption is better. And for other drugs, there is not much of scientific information, and it is better that you don't interfere in the management. Let the physician take a call, because they definitely know better than what you know or what a bariatric surgeon know. But it's a good idea to go on this and share this link with your physician if you had a bariatric surgery and you're going for treatment. Now, another aspect of it is home versus hospital treatment. Now here, as Dr. Kedar showed, the people who are obese or morbidly obese, they have significantly more severe disease. So right at the beginning, let me say, anybody who's obese, if beds are not in shortage, it is a good idea to go to hospital, because the physician can identify early, say, symptoms of a severe disease. Home treatments were introduced in our country also at a time when there was a shortage of hospital beds. And as mentioned by Dr. Kedar, COVID-19 is a serious threat because it's a novel virus. It causes arthritis, as he mentioned, because it enters lining of blood cells, which could be lungs, brain, kidneys, everywhere. Basically, if you are treating yourself at home, home treatment should be hospital treatment at home, and it is not to avoid hospital care. So if your family physician is ready to take care of you, provide adequate protection at home by regularly visiting you or getting the investigation done, which are normally done in a hospital, then only think of hospital home care. Mumbai experience has shown that early antiviral treatment prevents severe disease, like let's say remdesivir. If it is given in first 3 to 4 days, it probably prevents development of severe disease. And so it's a good idea, and this cannot be given at home. So it's a good idea to go to hospital. And then there are identification of high-risk markers, like what Dr. Kedar mentioned in his presentation. So those markers, if they can be identified, so they are routinely done in the hospital, but may not be done if you are being remotely managed at home by a social media friend or somebody who has recovered. So it is a better idea to get these markers done at home, and their treatment, early treatment, can avoid long-term problems. So friends, treatment at home, especially in bariatric patients or obese or severely obese people, at home should be seriously taken, even in asymptomatic and mild disease patients. A word about COVID vaccination. He has explained this, but just a word about it, that a vaccine like Covishield, even single dose, gives a protection of 92% against severe disease and 94% against 2 dosage. So this is very important, because we get carried away by 30%, 60% protection. But this is a established fact that protection against, even with 1 dose, is almost to the tune of 92%. And thus, it is a good idea to get vaccinated irrespective of your obesity status, because your life is precious to you and to your family and to the society. CDC in has very recently come out with guidelines. This has not come in India because we have not reached that threshold number of people who got vaccinated. But what they say, and it's worth listening, if you have, and I'm talking of US, I'm not talking of India. So those who are vaccinated, if you are visiting others vaccinated people, you can be without mask, without distancing. If you are visiting other non-vaccinated, low-risk person from a single household, so you can probably visit somebody who is non-vaccinated. This is, again, I'm telling you, this is American guidelines. But what it means is that if we all get vaccinated, we can reach this level of social interaction. And testing and quarantine is not required if exposed and if you are asymptomatic. So when you are vaccinated, fully vaccinated, and even if you are exposed to some infected person, you may not be required to undergo testing or quarantine in due course. So I think this is very important for us to realize that vaccination is important, and it is not related to bariatric. It is related to that vaccination should go as a message to everyone in the city that they should get it done. And the last slide is long COVID, because when I got admitted, Dr. Kedar mentioned about the risk of thrombosis, and I continue to take blood thinners even though it's now almost about 4 months after my infection, because 70 to 80% of hospitalized patients may have symptoms even 2 months after their COVID. And this is all published data. The chances of having long-term symptom, that means long-term disease, is not related to your hospital infection. So it has been seen that 33% of those who are not hospitalized, those who are managed at home, may have symptoms in 3 months. So I think it's very important that we all avoid getting COVID, because even if we get mild COVID, 33% of us may continue to have a disease, and that's very important. And just to conclude, long maybe fatigue, maybe shortness of breath, maybe problem of memory and concentration like brain fog, may lead to insomnia, sleep, palpitation, depression, and anxiety. So friends, it's time to think rationally and behave responsibly. A lot is being said about masking, social distancing. I think what is more required is to be responsible to yourself, to your family, and to your society. And that is my take-home message for the day. So thank you so much, and I'll be happy to answer questions.
Dr. Chiranjeev, Dr. Vishnu, any questions, please?
Sir, I have one topic question. Generally, I had so many patients who are COVID positive and taken the treatment, but they are already morbid obesity, means BMI than 35. So it is advisable to do bariatric surgery for that patient, and if possible, so how much duration after the COVID it is advisable to go for surgery?
Yeah, I think that's an excellent question. Aspects of it, Dr. Chiranjeev. One is that bariatric surgery numbers in US and have exploded after COVID, primarily because people have realized the risk of obesity and how this can be reduced. And insurance has also increased their funding towards bariatric surgery in those countries, because they feel that this is a better way to reduce the risk for those patients. As far as your specific question is concerned, yes, if somebody is indicated patient for surgery, so we go like this, and it's American anesthesia guidelines that if somebody had a mild disease, then 2 weeks after surgery, 4 weeks after surgery, after a COVID infection, they can undergo surgery. If somebody had a moderate disease, then 6 weeks after COVID, they can undergo surgery. And if somebody had a severe disease, like somebody who was on a ventilator or something, then at least 8 weeks after the COVID-19. And a good parameter is that there always we get a CT scan done if it has not been done after COVID, to see residual pulmonary damage, and also to look at their thrombotic profile. So these are two risk factors that we need to identify, primarily for anesthesia-related issues. Yeah, we have operated almost 4 to 5 recently who have recovered from COVID, and based on these parameters that I mentioned.
Great. Okay, so Dr. Raman, I also have one question for you from the audience.
Sure.
So I'm just going to read it out. So one of these studies suggests that the COVID-19 pandemic is having a substantial negative impact on substance use, mental health, and weight-related behaviors in diverse bariatric surgery patients. What is your observation on this?
I think this is happening across the board in society. It's not only in bariatric patients that people are gaining weight, people are using substances, or people are consuming alcohol more frequently. So I think this is because people are homebound, and the other means of entertainment are less, and they are probably. So I think it's a psychological problem in the society, needs to be addressed aggressively by the healthcare infrastructure in the country. Unfortunately, because our public healthcare doesn't take this account, people will have to go to private or psychologists to avail this care. I think Dr. Kedar must also be seeing medical more frequently with this kind of problems like substance abuse or psychological disturbances. Dr. Kedar,
Depression is a major factor. So we see a lot of patients post-COVID going into depression. Various factors, the disease itself, and of course the socio-economic status. They are out of jobs, they are at home. So all that adds to the problem. We are seeing a lot of children who are affected also. So children, because they are unable to go to school, they are unable to interact with their other friends. So that has impacted a lot of pediatric population also, and that's really bad. So, insightful question asked by Rudu that when are the schools starting? So that is really important. But as I said, it's still time to go in India. We need to ramp up our vaccination drive so that we can open up schools and we can open up the other areas also.
Plus, I also like the idea that Dr. Raman said that maybe fit and maybe overall this program should be taken into account, in terms of public health when we talk about the overall wellness. I think, these things are still not being in India, and I hope the future is bright and we are able to have that as a curriculum and fingers crossed. And that brings us to the end of the session, I think. Now, a very, very special thing, we have Miss Mritu Manocha with us. So I think the we have discussed, the experience will be best shared by the patient herself. We welcome you on board, Miss. You unmute yourself. First of all, the entire team of Doc Plexus and Dr. Raman and Dr. Kedar, we would like to congratulate you. You are very brave. Accepting obesity itself is a very big step, and then accepting it, asking for help, and out of it so nicely. I think kudos to you. So I would just want you to go ahead and share your overall experience, entire journey been for you.
Good evening, everyone. Thank you for this opportunity. And okay, not much of a background. I've always been a very big person. I'm 5'7", and my highest was 100 kgs. So I was born 4 kgs, full 4 kgs, full term. So I've always been huge, big person. Even in school, I was always on the line where the fatter girls stood. It's always been like that. Earlier it was fine because I was sporty. I was in sports, so it was okay. But that up and sports gets out of your life and you tend to put on weight. It just went on. Then children and so on and so forth. So very blessed that we got a chance to talk to Goyal. Went surgery, and then a year later I went. This was in 18 September precisely. So I really didn't have anything such as a comorbidities, as you all say. No BP, no nothing. It was just a checkup which my husband had a year post-surgery. That's when even I went for the post-checkup, and my sugar came very high. Within 20, something like that, a random sugar. So that's when Sir said that, this can only bring bad news in the future. As of now, you're fine, you're active, everything's going great for you. But this will only bring bad news later on, considering that both sides can be diabetic. So we took the call. Sir was very kind enough to do the entire procedure and how it would affect and everything. All went well. And I came down to a 75, 77, I should say. So, which was immense considering I came down from 120 and I am a big person. So, all was fine. Everything went off well. We have been doing well. And last year, that's again in September last, is when I got COVID. Now, in my case, a little background on my body situation is that until unless the temperature doesn't go over 102, the thermometer doesn't catch my temperature. To touch my body feels still normal, but I know I'm burning up on the inside. So that was my situation. Again, Vineet had contracted COVID before me, and he was in the state of recovery. He was quarantined in the house. We kept him in a separate room, but it happens. You generally tend to get it once someone in the family has. And since I was the attending person to him, I suppose that's how I got it. I didn't get cough. I didn't have very high fever, and also my O2 stayed normal. So so I thought, चलो सस्ते में छूट दे, कोई बात नहीं, थोड़ा सा fever रहा है, and I'll be fine, and everything will be fine. There won't be problems as such. But okay, during those 14 days, I'm very blessed that not only did I have Dr. Madhu and Dr. Raman Goel by my side, I also here I'm in Gurgaon currently, so I'm very blessed to have good doctors always. So even she, it was her suggestion that you are a bariatric surgery patient, you should speak to your doctor also. And that's when we realized, this is what it has been. So we need to, so that we need to, even get that, take that into consideration, because we started living a life. It was so normal for us. We just forgot hum kabhi mote bhi the. So I got in touch with Dr. Madhu, who asked me to send her all the reports and everything. And she was very on point. She said, no, whatever supplements you've been taking is going fine with you. If you have fever, what your doctor has suggested is fine. Let's go with that. So I thought, okay, everything's going to be great and fine. Fever, no heavy duty symptoms, nothing. And we finished with our quarantine, and after the quarantine, got back onto work regularly. As in, we've been working from home. So again, that 9 to 6 grind started. But that is when it hit. The kind of weakness that COVID gives you, in spite of being in touch with doctors regularly, in spite of taking the medicines as they told me, I was very mindful of doing that. Stay hydrated, take your medicines on time, eat food, जैसे तुम्हें सिखाया गया. The way what as a patient, you get conditioned to eat your food, all portions, and so all that was going on. But in spite of that, suddenly it crept up. Say, for example, if I started my day by around 12, I used to feel fatigued. I used to feel very weak. So my first thing was to call Dr. Madhu and ask her, and she said, no, this could be a fallout of the COVID situation. Take time, take rest. You have to understand, don't push yourself, exert mat karo. So slowly and steadily, yes, it took time, and I think 14 days of COVID and another 2 to 3 weeks before I could say, yes, I can work a complete day without feeling weak. During that period when I used to feel weak in the afternoon, I tried various combos, maybe having a fruit earlier or later, or having breakfast at a different time, things like that. But it was, I think, only COVID related. It wasn't anything else. That's been my journey. Yes, when it comes into weight loss, what happens is when you're sitting at home, I belong to the category of people, where they say you can think of food and put on weight. I belong to that category. And so anyway, yes, I did put on weight, and it has been difficult to get it off for the simple reason gyms are not allowed. They're closed. They opened and then going there or whatever, and then they have these various slots. They'll only take 5 or 10 people. So I always tend to miss that slot because I'm busy working. The only time it's free, it's in the afternoon. I'm working. So anyway, those are excuses. So the point, if I have put on weight, it is only because of inactivity, not because COVID made me put on. There are, for example, people who are busy and who are active, who have to go out and everything. My job is more inside. It's more on the lap, indoors. So less scope of activity, so to speak. But yes, during COVID, ma'am had suggested that I should do mind breathing exercises and thoda sa yoga kar lo, thoda sa, just keep yourself busy kind of a thing, which I did. And yes, that helped a lot. as we had to go through, isolation. So it kept me sane doing all that, and that continued even later on for us. Just a little mild yoga, mild meditation, or whatever. Yes, moving around in the house. Doctor had suggested earlier. So we kept doing those kind of things, which kept us going. But when a person who puts on weight easily, that is very less exercise. Yes, it keeps you going. It just keeps your body, I think, on the move, so that jam na ho jaye all your parts. So that has been my journey, and now it's almost a year since we've recovered. We don't have any. Both of us don't have any other symptoms, so as to speak, that would define that we had COVID as such. We've been, in fact, September is when we had COVID. By the end of the year, we were absolutely fine. We were back to being normal. But thanks to the lockdowns and everything, our exercise hasn't been hardcore. We would to be, or as it should be. So that is our biggest issue, which hopefully will get resolved soon. Things moving up now. So any questions or any queries?
Thank you. That was an amazing experience. So just let me just ask this question. This is Raman also. So from what I understood, Ms. Mridu, entire bariatric surgery and the entire weight loss, I think that it helped you fight COVID better. It helped you fight, cope up better. Is that?
Yeah, quite likely, but you can never be sure about this because obviously she lost substantial weight, and that reduces her risk towards COVID.
Correct.
So
that is what
she had a mild disease, and she came out of it, and that's more important.
Yes.
Definitely, weight loss is so important. Whether it happens through somebody who just wants to lose 5 kgs or somebody who wants to lose 35 kgs, then bariatric surgery is definitely a good choice. Yeah.
I think that explains a lot to a lot of people. That might motivate a lot of physicians, and then the physicians can motivate their patients. So I have one last question for you, Ms. Mridu. How did this entire thing affect you psychologically, mentally? How did you cope up with it?
I'm sorry, I didn't answer.
Your entire weight loss journey from start to end, the surgery, the procedure, then coming, and the heavy changes in lifestyle, because being in Gurgaon, you tend to snack a lot, go out a lot, So how did that entire thing affect you psychologically?
So snacking and going out didn't affect at all, because I did that in Bombay, so Gurgaon is not to be blamed for it. I'm a thorough Bombayite. Lived all my life there. Now we are here only because of the jobs. Anyway, as I had mentioned earlier, I've always been a big girl. So draw out a line, I'm always on the fatter side of the line. I was never even in the middle. So when I grew as an adult, I realized that I'm never going to come on the other side. That's definite. So then my aim became, kam se kam middle mein to aa jaun. I don't have to be on that side. Anyway, it has been a lifelong struggle to lose weight. Earlier it was easier because we were younger, one is more active and everything. When you have children, life gets a little sedentary, you get caught up in various issues of your life, and it just goes on and on. So when I had this opportunity, frankly speaking, the point of my sugar being at 300 plus is very small and minuscule, because I was partially, my mind was already made up कि मुझे ये करना चाहिए, because it was one opportunity for me to look good. It is a very vain thing to say, but if someone can ever put yourselves in my shoes and then realize I have shoulders which are 17 inches, men don't have 17-inch shoulders. At 7 inches, I have really broad bones. So it is such a huge opportunity, and I knew that I am wearing a triple XL or a 4XL top right now. If when I get a surgery, even then I will not come down to an M or a regular L, an Indian L. It won't be possible for me because I already have such broad shoulders. So I will still be an XL, but that is such a big thing. You have to realize that, that thing that plays in your mind, that kabhi to life mein even I will look pretty. I mean,
You are very pretty.
No, you please just understand that, that you would look different. You look, So that was the whole idea that motivated me. And yes, it did happen. And yes, it still happens. And there's, the thing continued. So yes, it makes you feel very good. So psychologically, I'm at the all-time high in life. The person inside me is very simple. And be fat. So then somewhere we came halfway through. The inside and the outside person met halfway through, and that has been a brilliant experience. It is the whole thing, and I have to thank the entire team. That a lot of hand-holding, a lot of help, a lot of motivation to continue on the path. And I do feel they organize these group goalkeepers meeting. So anyone who goes through surgery must keep up meeting. It is very important. It is not just that you get some little tidbits of knowledge of how to, keep your diet in control. It keeps you motivated. So in the period of when I did not attend the goalkeepers meeting, I feel it was my loss and I did gain weight. But now that I'm back on track attending the meetings, even if it's online, no problem. You must attend it. You must, keeps you motivated, keeps you happy to, even that extra that you've gained now a little to pull it back. So it's been a lovely journey. Thank you, sir.
Beautiful.
Thank you. I think
Beautifully
Dr. Mridu was very elaborate about her journey.
I know the way she described the entire thing. I think I just want to, after the session, put on my shoes, go running, and it was a very, very beautiful way of describing it.
And that is the best part of it, best part of bariatric surgery is interacting with our patients, because they have so much to share. And she has another reason, because her husband is a very well-known chef, and
I can understand the plight now.
He's being fed well at home. I'm sure he's
totally understand
all
the plight.
those delicious dishes for her. And both of them have been very, very regular with our program. I
think that makes the success, I'm sure a lot of patients go through surgery, but their entire commitment to the program, like Miss Mridu has, makes the entire thing so successful. So I think, Dr. Raman, this was a great idea that we started, taking testimonials of patients for this program. That will motivate the doctors will motivate the patients, and hence it's just like the domino effect, as we call it.
I think more than motivating the patients, what happens is doctors only get to hear other doctors. So we are looking at theory that this is the BMI, this much would be the weight loss, but in real terms, to see a patient or a lot of patients over a period of that, how it has benefited individually in terms of their psychology, in terms of their day-to-day living, like Mridu said, in her mind, she sees herself in a different way than what she was physically, is such an important statement. Not many people will talk so openly about this. So, Mridu, thank you so much for sparing time to join us today.
Thank you, sir.
And Unnati, over to you, please.
Dr. Chiranjeev, do you have any questions for Ms. Mridu?
No, ma'am.
No? Okay. I think then we should wind the session for today. Thank you, Dr. Raman, again. Thank you for organizing this entire thing. Grateful to you for the time. Ms. Mridu, great to have you here, and we hope that you continue your journey, keep inspiring other people. And to all our viewers out there, I hope you're taking a lot of insights from this and the journey of the patients and Dr. Raman's experience and Dr. Kedar, whatever the physicians are sharing with you. I hope this is motivating you to motivate your patients, because of course, you being the family physicians, you are the first touch points of the patients. We hope to see you soon. We will be back again with another session on next Thursday, 6 p.m. Stay tuned with us. Stay safe, stay connected, and happy doc flexing all of you. Thank you for joining. Thank you, everyone. Thank you so much.
Thank you so much.
Bye-bye.